about vaccines. Obviously, everybody in Congress and in this country wants a vaccine. We want it as quickly as possible, as effective as possible. Let me ask the Honorable FDA Commissioner, sir, if, God willing, a vaccine is developed, and if we're able to produce it as quickly as we all hope we can, I would imagine that that vaccine would be distributed to all people free of charge, or make sure at least that everybody in America who needs that vaccine will get it, regardless of their income. Is that a fair assumption?
Senator, I certainly hope so. FDA is very committed to making sure that all populations in the United States, including those most vulnerable, are included in the clinical trials. And
well, that's not what I'm asking. What I'm asking is, if and when the vaccine comes, it won't do somebody any good if they don't get it. And if they have to pay a sum of money for it in order to profit the drug companies, that will not be helpful. Are you guaranteeing the American people today that that vaccine will be available to all people, regardless of their income?
Sir, the payment of vaccines is not a responsibility of FDA, but I'm glad to take this back to the task force. I share your concern that this needs to be made available to every American.
Does anybody else want to comment on that? Mr. Giroir, do you think we should make that vaccine, when hopefully it is created, available to all regardless of income? Or do you think that poor people and working people should be last in line for the vaccine?
I'm sorry, Senator, were you asking me?
Yes, Brett? I was, sir. Yes, I was.
No, my office is one of the offices committed to serving the underserved, and we need to be absolutely certain that if a vaccine or an effective therapeutic or preventive is available, that it reaches all segments of society, regardless of their ability to pay or any other social determinants of health that there may be.
Good. So what you're telling the American people today, that regardless of income, every American will be able to gain access to that vaccine when it comes.
They should gain access to it. I don't control, I think
you represent an administration that makes that decision.
I will certainly advocate that everyone is able to receive the vaccine regardless of income or any other circumstance.
Let me just switch.
Time, Senator Sanders.
All right. I'm sorry. All right. Thank you, Mr. Chairman.